Welcome student, this is the third lecture of unit number 2 of Biopharmaceutics and Pharmacokinetics. Okay. And the topic for today's lecture is factors affecting the renal excretion of drug. In the last lecture, I have told you about the renal excretion of drug. What is excretion, what is renal excretion, what is non-renal excretion, what is the difference between the renal excretion and non-renal route of excretion, what is clearance, what is the concept of renal clearance and other type of clearances. Okay. So, let us study about the factors affecting renal excretion. Okay. As I have told you, in the renal excretion there is involvement of kidney, there is involvement of a principal organ, that is the kidney. Okay. And the fundamental unit of kidney is nephron, that is involved in the excretion process. Now, so apart from the physiological processes that affects the urinary excretion process, there are certain factors that can affect the renal clearance of the drug or the metabolites. So, we have categorized these factors into following categories. First one is the physicochemical properties of the drug, second one is the plasma concentration of the drug, third is the distribution and binding characteristics of the drug, fourth is the urine pH, fifth one is the blood flow to the kidney, sixth one is the biological factors, seventh is drug interaction and eighth one is the disease states. Okay. So, first factor is the physicochemical properties of the drug. As the name indicate, what do you mean by physicochemical properties? If we break this physicochemical, we can get two things. First is the physical, second is the chemical. So, the meaning of physicochemical properties, physical and chemical properties of the drug, and these physical and chemical properties or these physical and chemical factors that can affect the renal excretion rate are molecular size, pKa and the lipid solubility. Okay. So, firstly we will study about the physicochemical properties of the drug. So, first property is molecular weight. Okay. So, molecular weight, the drugs that are having the larger molecular size cannot be excreted through the kidney. As I have told you in the previous lecture that the drug compounds that are having large molecular size or the drug compounds that are bound to certain plasma protein or certain blood constituent or to the RBC cells. Because of this bonding, because of this complexation, the molecular size of the drug will increase and the drug that are having the larger molecular size cannot get filtered across the glomerulus. Okay. That is why the drug that are having the larger molecular size cannot get excreted through the kidney. Okay. So, the agents that are having the molecular size less than 300 Dalton, that agent can easily get filtered across the glomerulus, or we can say that can be excreted through the kidney. Okay. So, if agent or the drug compound is water soluble, that then also it can be easily get excreted out from the kidney. Okay. Next is the lipid solubility or we can say lipophilicity. Okay. So, all of you are aware about this property of this lipophilicity. Because of this lipophilic nature, a drug can get permeation across the membrane or we can say GI membrane. Okay. When we studied the drug absorption chapter, in the drug absorption part, it was the lipophilicity, it was the property, that is the lipophilicity. Because of this property, the drug was able to get permeation across the GI membrane and it was able to get absorbed into the body and it was able to produce its pharmacological action or we can say the therapeutic action. Okay. And now, this property is responsible, this property is responsible for the reabsorption of drug from the urine to the blood. Okay. A lipid soluble substance can get filtered across the glomerulus, but it will get reabsorbed from the blood, from the urine to the blood, because the drug compound is having the lipid solubility, and because of this lipophilicity it will get permeate from the tubular membrane into the blood back, or we can say from the urine to the blood or from the urine to the body. Okay. So, the drug that are having the lipid solubility cannot be filtered and they are also reabsorbed into the plasma. Okay. Now, the pKa, that is the degree of ionization, this property also affects the renal excretion of drug. Okay. The urinary excretion of the drug is inversely related to the lipophilicity. Okay. A lipophilic drug is passively reabsorbed to a larger extent. Okay. So, these three are the physicochemical properties. Another physicochemical property is the volume of distribution. A drug that is having the high volume of distribution, that will be having the decreased capacity to get excrete out through the kidney, because it is distributed in a large volume. So, it is very difficult to get it removed from the body through the kidney. Okay. The degree of ionization is also affecting the renal excretion of drug, and another factor or another property that affects the renal excretion of drug is the stereochemical nature of the drug. Okay. The stereochemical nature of the drug can also influence the renal clearance. Okay. If the drug is getting stereoselectively protein bind, then also it cannot get filtered from the glomerulus and it is not possible to get it excrete out from the kidney, okay, from the body with the help of kidney. Okay. So, these were the physicochemical properties. The first property was molecular size, second is lipid solubility, third is volume of distribution, degree of ionization and stereochemical nature of the drug. These are the physicochemical properties that are affecting the renal excretion of drug. Now, the second property is the plasma concentration of drug. Okay. The concentration of drug in the plasma, or we can say amount of drug in the body or in the systemic circulation, that can also affect the renal clearance of drug. Okay. So, this is the diagram that is showing the correlation between the renal clearance and the plasma drug concentration, and also the rate of excretion with the plasma drug concentration. Okay. So, the glomerular filtration and reabsorption are directly affected by the plasma drug concentration, because the glomerular filtration as well as the reabsorption both are passive process. That is why they are affected by the plasma drug concentration. Okay. So, a drug that is bound to plasma protein and it can excrete by the filtration only. Okay. We are having three categories 1, 2 and 3. In the first category, there are drugs that can be excreted by filtration process only. In the second category, there are the drugs that can be filtered and actively reabsorbed. Why they are reabsorbed? Because of their lipophilic nature. And third category is the drug filtered as well as actively secreted. Okay. So, we are having three categories depending upon the three mechanisms that are involved in the renal excretion process. Okay. And when we correlate these three categories with the plasma drug concentration, then what we obtain? We can say when rate of excretion is plotted against the plasma drug concentration, then we will get a linear relationship. We will get a linear relationship for all these three categories. Okay. And if we plot renal clearance versus the plasma drug concentration, then for the drugs that are filtered across the glomerulus, for that we will obtain a linear line, and but for the category 3 and category 2, what is the category 2? In which drug is getting reabsorbed, and category 3 is in which drug is getting excreted. We will obtain this curve. Okay. So, this is the correlation between the plasma concentration of the drug, or we can say this is the effect of plasma drug concentration on the renal excretion of the drug or renal clearance as well as on the rate of excretion. Okay. Means whatever type of process is involved, rate of excretion is showing a linear relationship with the plasma drug concentration. Okay. Now, next property is the distribution and binding characteristics of the drug. Okay. As I have told you, the clearance is inversely related to the apparent volume of distribution of the drug. Okay. Means a drug that is having the larger volume of distribution or larger apparent volume of distribution, that will be poorly excreted out in the urine. Okay. The drug that is bound to the plasma protein cannot be filtered out through the glomerulus. Why? Because when it bound to the plasma protein, the complex formation will result in increase in the molecular size, and because of this increased molecular size, it cannot be able to get filtered across the glomerulus. Okay. So, and also the clearance is inversely related to the apparent volume of distribution of the drug. So, the drugs that are having the low apparent volume of distribution, that will be betterly excrete out in the urine, and those that are having the larger apparent volume of distribution, that will be poorly excreted into the urine. Okay. So, only the unbound drugs can be able to get filtered across the glomerulus. Okay. So, we can say that only the free drug or the drug that is available free, that can get permeate across the glomerulus, that can be able to get excreted out in the urine. Okay. So, we can obtain the fraction of drug that can bind to plasma protein by a formula, that is Fu is equal to Cu upon C. Now, what is Fu? This Fu is the fraction of unbound drug. This Fu is the fraction of unbound drug. This Cu, what is Cu? This Cu is the concentration of unbound drug. And what is this C? It is the total plasma concentration. Okay. So, if we want to calculate the fraction of unbound drug, then we use this formula. Okay. So, this is the effect of distribution and binding characteristics of the drug on the urinary excretion of drug. Now, next factor that can affect the renal excretion of drug is the blood flow to the kidney. See, the blood that is flowing across the kidney will also play a major role in the renal excretion of drug. Okay. Because it is very important in case of the drugs that are excreted by the glomerulus or filtration only. Okay. And also to the those that are actively secreted. Okay. So, in actively secreted drug, the renal clearance, we can say it is perfusion rate limited. Perfusion rate limited means what is the rate of blood flow. When the drug is getting secreted or drug is getting excreted out by the tubular secretion process, then renal clearance will depend upon the rate of blood flow. Okay. So, in case of actively secreted drug, we can say the renal clearance is perfusion rate limited. Okay. Because if there is increased perfusion or if there is increased blood rate, then the contact of the drug with the secretory sites will be there, increased contact will be there, and there will be enhancement in the elimination rate. Okay. So, this is the effect of blood flow to the kidney on the renal excretion. Next is the biological factors. We are having different biological factors, for example, age, sex, species, strain difference or difference in the genetic makeup or circadian rhythm. These type of factors can also affect the drug excretion process. Okay. How the renal excretion is approximately 10% lower in female than in the male. Okay. This is the effect of the gender on the renal excretion of rate, because the renal excretion is approximately 10% lower in female as compared to the males. Okay. And if we talk about the age, then age is also having an impact on the renal excretion of drug. For example, in case of newborn, the renal excretion is 30 to 40% less as compared to the adults, and when they attain maturity between 2.5 to 5 months of the age. Okay. Now, the when we talk about the GFR, that is the glomerular filtration rate, in old age the GFR is reduced and the tubular function is altered also. So, the age is also having impact on the renal excretion of drug. Next factor is the drug interaction. Okay. If the drug interaction or drug alteration takes place, because of the drug interaction there can be alteration in the protein drug binding characteristics, there can be alteration in the urine pH, there can be alteration or there can be competition for the active secretion, there can be forced diuresis. Okay. The drug interaction is having 4 different types of impacts. First is the alteration in the protein drug binding, second is the alteration in the urine pH, third is the competition for the active secretion, and fourth one is the forced diuresis. So, these 4 would rather affect the clearance of the drug. Okay. First factor is the alteration in the protein drug binding. Okay. The renal clearance of a drug that is extensively bind to the plasma protein binding is increased when another drug displaces the drug. When there are displacement interaction, then there can be alteration in the protein drug binding. Okay. So, the example of this type of reaction is the gentamicin induced nephrotoxicity by the furosemide. Okay. In this there is alteration in the protein drug binding and it can accelerate the renal clearance of the antibiotic, that is the gentamicin. Next is the alteration of urine pH. If there is acidification of the urine with the ammonium chloride, with the methionine or ascorbic acid, that can also enhance the renal excretion of the basic drugs. And if there is alkalinization of the urine, then it can promote the excretion of some acidic drugs. So, this is the impact of urine pH on the renal excretion of drug. Next is the competition for active secretion. For example, phenylbutazone drug. This phenylbutazone drug can compete with hydroxylamide, that is its active metabolite or an agent that is for active secretion, and its action can be prolonged. Next is the forced diuresis. All type of diuretic drugs, they can increase the elimination of the drug whose renal clearance can get affected by the urine flow rate. Okay. So, this was the impact of drug interaction. Now, the last factor that is responsible for the disease state is the renal dysfunction and uremia. Okay. There are 2 different type of disease state, or we can say disorders, that can have impact on the renal excretion of drug. Now, what is renal dysfunction? This renal dysfunction, it greatly affects the elimination of the drug. How? It will affect the elimination of drug that are getting primarily excreted by the kidney. Okay. For example, in case of there are some of the causes of renal failure are hypertension, diabetes mellitus, hypovolemia or polynephritis. In these states, renal dysfunction can be there and there will be great impact on the renal excretion of the drugs. Next is the uremia. Now, what is uremia? It is characterized by the impaired glomerular filtration, and because of this impaired glomerular filtration, there can be accumulation of the fluids and the protein metabolites into the body, and also it can impair the renal clearance of the drug. Okay. So, in these conditions, whether it is renal dysfunction or whether it is uremia, in both of these conditions the half life of the drug is increased, and as a consequence the accumulation or the toxicity of the drug can takes place into the body. So, it is very essential to determine the renal function, so that we can monitor the dosage regimen. Okay. Now, let us have a recap of the factors affecting the renal excretion of drug. So, I have told you there are these different factors that can affect the renal excretion of drug. First is the physicochemical properties, second is the plasma concentration of drug, third is the distribution and binding characteristics, fourth one is the urine pH, fifth is the blood flow to the kidney, sixth is the biological factor, seventh is the drug interaction, and eighth one is the disease state. So, these factors can affect the renal excretion. The first factor is the physicochemical properties. In the physicochemical properties, there are molecular weight, lipid solubility, volume of distribution, degree of ionization, and stereochemical nature of the drug that can affect the renal excretion of the drug. If a drug is having the larger molecular size, then it cannot get filter across the glomerulus. Okay. If the drug is having high VD or apparent volume of distribution, it can also get easily, it will be unable to get excrete out from the kidney easily. Okay. Now, next is the plasma concentration of drug. See, the glomerular filtration and reabsorption are directly affected by the plasma concentration of the drug, as we can see in this graph or in this figure. Now, third is the distribution and binding characteristics of the drug. See, if a drug is bound to the plasma protein, then it cannot be filtered through the glomerulus because of the increased molecular size. Okay. And the clearance is inversely related to the apparent volume of distribution. So, the drug, if it is having the larger volume of distribution, then it can be poorly excreted into the urine. Okay. And we can obtain the value of fraction of unbound drug by this formula, that is Fu is equal to Cu upon C. What is Fu? It is the fraction of unbound drug, Cu is concentration of unbound drug, and C is the total plasma drug concentration. Okay. Now, next factor that can affect the renal excretion of drug is the blood flow to the kidney. Okay. So, this factor is very important in case of drug that are excreted by the glomerular filtration only, and those that are actively secreted. Okay. So, in case of active tubular secretion, the renal clearance can said to be as the perfusion rate limited, or it will depend upon the rate of blood flow. Okay. There are certain biological factors, for example, age, gender, or that can also affect the renal clearance of the drug. For example, in case of female, the renal excretion is approximately 10% lower in the female as compared to the males. Okay. And when we talk about the effect of age, then the renal function of newborn is 30 to 40% less as compared to the adults. Okay. The last is the drug interaction. There can be certain drug interaction, for example, alteration in the protein drug binding, alteration of urine pH, competition of active secretion, and forced diuresis. These interaction can also affect the renal excretion of the drug. Last factor is the disease state. In case of disease state, there can be uremia or there can be renal dysfunction. In both of these disorders, the renal function or renal excretion will be get affected adversely. Okay. So, this was the effect of renal excretion of the drug. In the next lecture, I will discuss about the non-renal route of excretion or non-renal excretion of drugs. Thank you.